holidays are a time of celebration for so many of us, but for some, it brings about serious health problems. Now, according to the American Heart Association, more people die from heart attacks during the last week of December than at any other time of the year. Our Marissa Mitchell has more.
Christmas should be a time of joy, celebration, and indulging, but health experts warn of something serious that can happen. More people die from heart attacks on Christmas Day than any other time of the year. That's all according to the American Heart Association. And Christmas Day is then followed by December 26th and January 1st. We have Dr. Ketan Trivedi from Virginia Heart here now to share what we all need to know. Good to have you in, Doctor. Why is it? Why do we see more heart attacks this time of year?
I think there's a lot of things going on here. The first is that during the holidays, people sort of break their habits, right? They may be eating properly, they're exercising normally, but over the holidays, they get busy, they kind of break their routine, their diet goes downhill, there's a lot more salt and sugar consumed, people stop exercising, they may forget to take their medications because they're busy doing stuff with friends and family, and as a result, they don't act the same around the holidays as they act on the other days of the year.
We talk about stress, too. Would you say that they may have already been having issues, right? But people tend to get more stress, and that can bring about those changes as well.
Absolutely. We know that stress and cardiac issues go hand in hand. And you said, you know, the holidays are supposed to be a festive time for joy, but for a lot of people, there's a lot of stress associated with that as well, and that can certainly play a role.
Okay, so tell us about the signs. You know, if you, unfortunately, you or someone you love is having a cardiac event, what should you be looking for?
So it's the symptoms that are typically associated with heart disease are things like chest discomfort. It can be pain, pressure, tightness in the chest, the neck, the jaw, the upper back. Sometimes it's just shortness of breath, racing heartbeat and palpitations, dizziness, fainting. If you experience all of that, any of those symptoms, you should really think about seeking medical attention. One of the things that happens is that people have friends and family over, they start having symptoms, and they don't want to ruin the holiday by going to the hospital, so they ignore it. They try to pretend it's something else, when really they're sitting on something dangerous. So you don't want to do that. If you're worried about ruining the holiday, make sure you actually get this checked out. Otherwise, you really could ruin the holiday.
When you're thinking about getting it checked out, should you be looking at the frequency of these symptoms or how strong they are?
All of the above. I mean, if you're feeling okay, then something changes. If you're starting to get something different, something new, a symptom you've never experienced before, you don't want to ignore it. The other thing is alcohol. People tend to drink a fair amount more over the holidays than they do, and there's certain heart conditions, particularly something called AFib or atrial fibrillation, which is an abnormal heart rhythm, and that can get triggered by alcohol. So you really want to be careful, particularly if you've had a history of AFib in the past.
So how can we prevent, Dr. Trivedi, some of these things for getting to that point?
So try to stick to your routine. Make sure you take your medications on time. Try not to change your diet too much. Really, especially if you have a tendency towards something called congestive heart failure, salt is not your friend. So you really want to stay away from that. Take your medications as directed. Try to keep your normal routine as much as possible. And if you have symptoms, don't ignore them.
And I know a lot of time, too, when we're with family and friends, we talk about movies a lot here as well. You're sitting on the couch all day, taking in a lot of entertainment. You still want to be active.
You do.
That's important.
It's fine. It's great to sit on the couch and have fun, but spend 15, 20 minutes, go out for a walk, do something a little bit physical in between all of that.
Yeah, keep the health top. You got to have your health right in order to do anything else.
Otherwise, you got nothing else.
Absolutely. Dr. Trivedi, thank you so much for joining us. Where can people stay in contact with you for more information and expertise?
You can look at our website. It's virginiaheart.com.
All right. Thank you, and happy holidays. Happy New Year.
Same to you.
As
Thank
well.
All right. Thank you to Marissa and Dr. Trivedi. An incredibly important conversation to have
indeed.
As we go into the new year.